Spot these 6 signs early can drop prostate cancer death risk to as low as 0%. Before watching, please note that survival varies from person to person, and no one can say for sure how long someone will live. The statistics in this video are based on large studies, but remember, they don't define your personal outcome. Prostate cancer is one of the most common cancers affecting men worldwide. But for many men, it's not an immediate death sentence. The American Cancer Society estimates that about 1 in 8 men will be diagnosed with prostate cancer in their lifetime, but only 1 in 44 will die from it. That gap tells us something big. Most cases aren't fatal. Why? Prostate cancer can range from relatively low risk to highly aggressive, depending on its type and stage at diagnosis. A lot of prostate cancers grow so slowly that they never cause major trouble. Some men live with it for decades and pass away from something else entirely, like heart disease or old age, without the cancer ever rearing its head aggressively. A 2016 study, the PROTECT trial, followed men with localized prostate cancer in stages 1 and 2. After 10 years, only about 1% died from it. Another 2021 review suggests that many men with localized prostate cancer can safely delay treatment without increasing their risk of metastasis, known as the spread of cancer to distant organs, or death. The review found that metastasis risk ranged from 0.1% to 1.0% at 10 years, while prostate cancer death risk ranged from 0% to 1.9%. That said, not usually fatal doesn't mean not dangerous. The danger creeps in when the cancer is aggressive or caught late. It can grow faster and spread beyond the prostate to places like the bones, lymph nodes, or even organs like the lungs. Once it's metastatic, meaning it's spread, the stakes get higher and prostate cancer can become life-threatening. While local and regional prostate cancer has a nearly 100% 5-year survival rate, survival drops sharply for advanced cases in stages 3 and 4 to 37%. While early detection improves outcomes, screening methods and recommendations for early detection are complex, but they are getting better. Prostate cancer often grows slowly and without symptoms in its early stages. It can take years, about 15 to 20 years or more, before it's big enough to detect, and even longer before it spreads beyond the prostate. During this time, treatment may not be necessary. It is important to understand the signs and symptoms along with your own risk factors for disease so that you can discuss with your doctor early detection options and when treatment is required. In this video, we will unpack what prostate cancer is, who's most at risk, the signs to watch for from early whispers to late warnings, how serious it can get, and the smart steps you can take to tackle it. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Who's most likely to get it? Age is the biggest player here. While prostate cancer can develop in any man, it is rare in those younger than 40 and most prevalent among older men, particularly those over the age of 50. By the time men hit their 60s and 70s, it becomes much more common. According to the American Cancer Society, about 1 in 8 men will be diagnosed in their lifetime, but about 6 in 10 prostate cancers are diagnosed in men who are 65 or older. Moreover, about 65% of new prostate cancer cases are found in men over 65, and about 25% occur in those over 75. Besides age, family history also plays a role. If your dad or brother had prostate cancer, your risk doubles. Race factors in too. African American men are more likely to develop it and often face more aggressive forms, though researchers are still piecing together why. Lifestyle, like smoking, being overweight, or having a diet heavy in dairy products or calcium and red meat, might nudge the odds up slightly, but it's not as clear-cut as age or genetics. In short, if you're an older man with a family history, you're in the higher risk club, but it's something every guy should keep on their radar as they age. Signs of prostate cancer. Spotting prostate cancer can be tricky because it's a bit of a silent operator, especially in the early stages. Doctors typically recommend screening only for men between 55 and 69 who are at higher risk, but these recommendations are still under review. Yet in certain cases, some signs and symptoms can still appear. They vary depending on how far along the tumor is, so let's break them down into two groups: early signs and later stage signs. We'll explain each one, how it ties to prostate cancer, and whether it's a specific red flag or something that could point to other issues too. Let's get into the details. Early signs of prostate cancer. Again, in its initial stages, prostate cancer may not present noticeable symptoms. However, as the tumor grows, while still curable and in the low-risk stages, it can start to affect urinary and reproductive functions, causing symptoms. Sign 1. Trouble urinating. A common early symptom is difficulty starting or maintaining a steady stream of urine. Maybe you're standing there longer than usual because the stream is weak, hard to start, or starts and stops. Some may feel difficult when starting to urinate, or hesitancy. This happens because the prostate sits right around the urethra, and as the cancer grows, it can squeeze that tube, making it harder for urine to flow smoothly. A study of 21,159 Norwegian men found that those with severe lower urinary tract symptoms, or LUTS for short, had more than twice the risk of being diagnosed with prostate cancer, especially localized cases. But here's the catch. It's not specific to cancer. An enlarged prostate, called benign prostatic hyperplasia, or BPH for short, or even a urinary infection can mimic this, so it's more of a nudge to get checked than a neon sign screaming cancer. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. Sign 2. Frequent urination, especially at night. Another early hint is the need to urinate more often during the night. You might find yourself waking up 2 or 3 times to hit the bathroom when once was enough before. This is called nocturia, and it's linked to the prostate pressing on the bladder or urethra as the tumor grows. It can cause an increased urge to urinate, even when the bladder is not full. Many people don't report it to their doctors, assuming it's a normal part of aging. Nocturia may pop up in early prostate cancer, but again, it's not exclusive. In fact, trouble urinating is rarely caused by prostate cancer. It's much more likely to be due to BPH, a common non-cancerous condition. It's non-specific, but if it's new for you, it's worth noting. Some men may also experience a feeling of incomplete emptying of the bladder. Even after urinating, there may be a sensation that some urine is left behind, leading to repeated trips to the bathroom. This can be frustrating and disruptive to daily life, signaling an issue with prostate function that requires further investigation. Sign 3. Blood in the urine or semen. Seeing a pinkish tinge in the toilet or a streak in your semen can be alarming, and it should be. Medically known as hematuria and hematospermia, respectively, the presence of blood can indicate that cancer has begun to invade surrounding tissues or cause damage to blood vessels. While blood in the semen or urine can sometimes result from BPH, infections, kidney stones, strenuous exercises, and certain medicines, its appearance, especially when persistent, should be promptly evaluated. In prostate cancer, this can happen if the tumor disrupts tiny blood vessels in the prostate or urethra. It's a signal to pay attention, especially if it sticks around. Later stage signs of prostate cancer. As prostate cancer advances, symptoms tend to become more pronounced and severe. Sign 4. Painful urination or ejaculation. Cancerous growth in the prostate can lead to inflammation and irritation, causing discomfort during these functions. This pain may range from mild to severe and can interfere with normal activities. Men with advanced prostate cancer often experience more severe pain. The discomfort is often due to the tumor pressing against the urethra or affecting nearby nerve endings, leading to irritation. Although infections, such as prostatitis, can also cause similar pain, persistent discomfort should not be overlooked. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Sign 5. Bone pain. In more advanced cases, prostate cancer may spread beyond the gland itself, leading to persistent pain, especially bone pain due to bone metastases. When cancer cells invade the bone, it can cause inflammation and weaken the structure. You might feel a deep ache in your lower back, of the spine, hips, pelvis, chest, of the ribs, or thighs, places where bones are common targets for prostate cancer spread. Prostate cancer can spread to bones because it's linked to a network of veins in the spine, making it easy for cancer cells to move there. Bone's rich blood supply and marrow environment also support tumor growth. Unlike typical muscle or joint pain, cancer-related pain is often deep, aching, and does not improve with rest, over-the-counter pain relievers, or even opioids. Many patients with advanced bone metastases struggle with pain relief due to limited drug effectiveness and side effects. A 2013 study in inflammopharmacology found that around 70% of patients with metastatic prostate cancer develop bone lesions, leading to severe pain, fractures, and spinal cord compression. It's fairly specific when paired with other signs, since everyday arthritis or a pulled muscle doesn't usually mimic this persistent, deep discomfort tied to cancer spread. Sign 6. Unintended weight loss and fatigue. If you're shedding pounds despite eating your usual burgers and fries, it could mean the cancer is revving up your metabolism or stealing energy as it grows and spreads. Research also links unexplained weight loss to advanced cancers, including prostate. It's not specific. Other cancers or illnesses like diabetes can do this too, but it's a red flag when combined with other symptoms. In fact, adults with weight loss are up to 12.5 times more likely to have cancer than those without it. In people over 60, more than 1 in 10 with unexplained weight loss will be diagnosed with cancer. Fatigue that won't quit is another latecomer. We all get tired, but this is different. Like your batteries stuck at 10% no matter how much you rest. Unfortunately, up to 90% of men with advanced prostate cancer experience fatigue. Advanced prostate cancer can sap your energy by releasing chemicals that disrupt normal body functions or by affecting your hormones. It's nonspecific. Stress or depression can mimic it, but it's concerning if it's new and relentless. Effective strategies to manage it included exercise, naps, more rest, and a healthy diet. Work closely with your doctor or dietitian to find what suits you best. When cancer spreads, it can affect the body's metabolism and energy levels, leading to unexplained weight loss and a persistent sense of exhaustion. Their presence in conjunction with other prostate-related issues should prompt immediate medical attention. How many symptoms should raise concern? Since many prostate cancer symptoms overlap with benign conditions, experiencing one symptom in isolation does not necessarily indicate cancer. You're probably wondering, how many of these need to stack up before it's time to panic? The truth is, it's less about the number and more about the pattern, timing, and context. One sign, like a weak urine stream, might just be your prostate aging. But if you're juggling 2 or 3, especially a mix of early and late stage ones, that's when the alarm bells should start ringing in your head. For example, let's say you're peeing more at night and seeing blood in your urine. That combo could still be an infection or BPH, but it's enough to warrant a chat with your doctor. Add in bone pain or unexplained weight loss, and the stakes go up. Those late-stage signs suggest something more serious might be brewing. If you notice multiple symptoms occurring simultaneously, it significantly raises the likelihood of a prostate issue. There's no magic number. Even one persistent sign, like blood that keeps showing up or fatigue that's crushing your daily life, deserves attention if it's new, unusual, or won't go away after a couple of weeks. Context matters too. If you're 65 with a dad who had prostate cancer, one sign might carry more weight than if you're 40 with no risk factors. The key is to listen to your body and not brush off changes just because they're not that bad yet. Also, men who exhibit 2 or more symptoms should seek medical evaluation promptly. Furthermore, if symptoms worsen over time or become increasingly disruptive to daily life, it is a strong indication that further investigation is needed. Prostate cancer, if caught early, is highly treatable. Delaying evaluation can allow the disease to progress, reducing the chances of successful treatment. What to do when symptoms appear? So you've noticed a couple of these signs. What's the next step? First, take a deep breath. It is important that not every male will be offered a diagnosis, and not every diagnosis will result in cancer treatment. Even if it is, catching it early can make a world of difference. Here's how to handle it. Start by tracking what's happening. Jot down when the signs started, how often they hit, and how bad they feel. If it's urinary stuff, note if it's every day, or just after a big glass of water. If it's painful, is it dull or sharp? This isn't just busy work. Doctors love details because it helps them figure out what's going on faster. Next, call your doctor. Don't wait for it to sort itself out. Prostate cancer doesn't send RSVP cards, and neither do other conditions that mimic it. Your doctor will likely ask about your symptoms, your family history, and your overall health. They might suggest a prostate-specific antigen or PSA blood test, which measures a protein the prostate makes. Higher levels can hint at cancer, though infections or BPH can bump it up too. Men with a PSA under 10 nanograms per milliliter had a 1.3% risk of death, while those over 20 nanograms per milliliter had a 4.6% risk. Therefore, abnormal PSA results often lead to further testing. There is no set cutoff level for PSA to be considered at risk for prostate cancer, though often doctors use 4 nanograms per milliliter to then consider additional screening tests. A digital rectal exam, or DRE for short, could also be offered, where they feel the prostate for lumps or hardness. It's quick and could save your life, but not as effective as PSA. If those tests raise flags, you might get sent for more. A biopsy, where they snag a tiny piece of prostate tissue to check for cancer cells, or imaging like an MRI to see what's happening inside. This isn't a conveyor belt to bad news. It's about ruling things out or catching them early. Don't forget that the survival rates are near 100% for localized cases caught soon enough. While you're waiting, don't spiral into worst-case scenarios. Keep eating well, stay active, and lean on a friend if you're stressed. Your body's still yours to care for. If it turns out to be cancer, treatments range from watching and waiting for slow growers to surgery or radiation for more aggressive types. Yes, sometimes waiting can actually be a treatment option for prostate cancer. For men with slow-growing prostate cancers, especially older men or those with other health concerns, immediate treatment might not be necessary. Instead, doctors may suggest active surveillance or observation, sometimes called watchful waiting. Your doctor will tailor it to you, and advances mean outcomes are better than ever. Now that you understand what could happen, remember that PSA tests aren't necessary for every man. The U.S. Preventive Services Task Force, USPSTF, doesn't suggest routine screening for everyone. Finding prostate cancer early might save lives, but it can also lead to overdiagnosis and overtreatment. Think of it like fishing with a net that catches both problem fish and harmless ones. You might end up taking action when you don't need to. For men over 70, doctors don't usually recommend prostate cancer screening. This is because most prostate cancers grow very slowly. At this stage of life, other natural health conditions tend to be more important to watch. Finding prostate cancer early doesn't actually help men in this age group live longer. Thus, even in 2025, there are still recommendations for shared decision-making with your doctor to participate in early screening. If prostate cancer is diagnosed, treatment options vary depending on the stage and aggressiveness of the disease. For early-stage cases, active surveillance may be recommended, where the cancer is closely monitored without immediate treatment. Treatments are suggested only if cancer grows. In more advanced cases, treatment options may include surgery, radiation therapy, hormone therapy, or chemotherapy. Surgery or radiation can help get rid of the cancer, but they might bring side effects like incontinence or erectile dysfunction. Some men face urinary issues post-treatment, which isn't life-threatening, but can hit them hard emotionally. For advanced cases, hormone therapy or chemo can slow the cancer. Nearly all treatments for prostate cancer leave one fatigued or weaker. It's a balancing act, controlling the disease versus living well with the fix. Conclusion: prostate cancer is a bit of a mixed bag. It's common, striking 1 in 8 men, but it's not always the grim reaper people fear. For many, it's a slow crawler, caught early through tests like PSA screening, with survival rates near 100% when it stays in the prostate. Not all persons with prostate cancer need treatment, and a doctor will assess if active surveillance is for you. For those who need treatment, it is most effective before the cancer spreads. The early signs, like urination troubles or a little blood, can be subtle and easily confused with other issues, while later clues like bone pain or weight loss signal, it's gotten serious, dropping survival odds to around 30% if it spreads. If you spot even one persistent sign, don't wait. Track it, call your doctor. After discussing with your doctor your symptoms, along with your risk factors such as age, you can make a shared decision on the next best step, such as PSA testing. Annual physical exams, especially for men over 50, play a crucial role in having a regular discussion with your doctor on your risk and potential need for early detection of prostate cancer, potentially saving lives. The key is awareness, vigilance, and timely action. Recommendations on early screening are changing with today's advances, and prostate cancer's a foe you can often outsmart, turning a potential storm into a passing cloud. Stay sharp, stay checked, and you've got the upper hand. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Your prostate relies on your kidneys more than you might think. Healthy kidneys support it by maintaining clean blood and easing urinary flow. The sooner you spot kidney issues, the more you can do to keep things under control. If you're unsure about your kidney health and haven't been in a good shape recently, check out the video on the screen. Here, we cover all the possible symptoms, helping you spot kidney failure and take action effectively if needed. See you there. Stay informed, stay healthy.